Hello everyone, and I'm happy to have with me Dr. Gowtham Reddy. He's secured a rank of 22 in NEET PG 2019. Heartiest congratulations, Gowtham.
Thank you, ma'am.
This is an amazing rank, and I'm sure you must be feeling very happy.
Yes, ma'am. Very proud moment to me, and I'm coming for the second time in this hot seat.
Yes, because he's secured good ranks previously as well, and he totally deserves it. So Gowtham, doing this among 1.5 lakh students is not an easy job,
yes,
right? And so that's why you're here.
Yes.
And we really want to know what kind of effort has gone into getting this rank, right? And Gowtham has been a student with us from Foundation.
Foundation and TND batches.
And TND batch as well. And you were a satellite student?
Yes, from Varanasi.
He was a satellite student from Varanasi. So let me start with the satellite class itself. Gowtham, how do you think, would you sort of talk about satellite class? Does it give you a good feel of a real environment, because you can interact, you can ask your doubts, and you're sitting in a live class? And how important was that for your preparation?
Yes, ma'am. I would like to first mention, previously there used to be coaching only in Delhi.
Yeah.
So people have to come all the way here with a different environment, feeling homesick, the food,
right,
language, everything is problematic. But with satellite classes, there won't be problems for these things, because these things do matter in the preparation part.
Definitely. And
satellite things is it is not secondary to live class, I think, because you can it's our presence which makes difference. Because if you feel the teacher is watching you, observing you, then you will get involved and there won't be any difference. Because satellite classes are very interactive. You can ask doubt and teacher will be real time interacting with you.
Yes. Right. And Gowtham, how important is it to actually sit in a class and sort of clear your concepts or make your own set of hand notes and, learn from it?
Ma'am, it's very important to read notes which was written by us, because when someone actually in notes everything will be concise. So until unless you write it, you won't get what actually this point mean. Everything will be in words and sentence, mere phrases only. You have to get the gist of it, you have to listen and understand and then write and then keep on revising it.
Okay. And Gowtham, before I go to actually the TND phase of your preparation, let's just stick to the the classroom phase when you were attending the classes. What was your idea when you came to a class? Because there would be other students who are also doing regular course with us, right? And they would want to know that when they are coming for a class, what should be the goal of the student there? Because I think not just physical presence is important, you have to be mentally present in the class.
Yes, ma'am. First, ma'am, DAMS offers various courses. I joined it from very beginning. Like in the foundation course, I joined it because actually in this the world is very competitive, and
that's true.
I could make out what to focus on and what not through these classes only.
Okay.
First, actually in the beginning, to be very frank, I didn't got familiarized with that, but as the journey progressed, I got used to how to utilize DAMS effectively. First, I'll like to suggest people to just first keep attend the class, then go and read the notes.
Okay.
And previous to before all this, that must be the topic must be read from the textbook as well, so that you can understand what is being written in textbook, because all the textbooks are standard textbooks,
and the comprehension is much difficult. And
in our colleges, it won't be. Yes, professors will teach well, but there will be some gap in the knowledge part. And
do you think the preparation for your professional years is quite different from the preparation of your entrance exams?
No, ma'am. Because DAMS notes were very helpful in my professional exams as well. Especially in the final prof, medicine, surgery, and all the major subjects, gynae as well. And I read notes, and then partly notes and partly textbooks.
Right.
Because each will complement each other. No one will. One will not suffice.
Right. And now, so you used to attend class, make notes, and then read them again. Now, coming to your internship, when you were doing your test and discussion with us, Right. What was the, again, I would just ask you that what did you want to achieve through the test and discussion course?
Test and discussion again to get the latest information and to get on with the tests, because if you keep on reading like initially I just kept on reading for initial few months, and how much I remembered and how much not, I could not really make it.
Okay.
And so with the test and discussion, it was, I got to know that how much I remembered initially, though the schedule was not matching, but when I attended the classes which I of those subjects which I completed, and I got to know how much I remembered, and then in the revision part that made a significant matter, because
right. And do you think that the discussion that is held after the test is useful, because we would give you a lot of information in it?
Yes, ma'am.
And try and tell you what the high yielding topics are for a particular subject and how to approach the questions as well.
Yes, I really I must agree with on this point, because I really did feel it. The topics which are currently asked very often are focused on the T&D's part, and which were previously asked and important topics are being stressed upon.
Right. And again, because a lot of students are also doing the similar course with us, can you tell us what did you do a week that was given to you for the test, and after the test also did you give some importance, or what exactly did you do then?
Ma'am, the notes which I made in for the test and discussion, I did not depend mainly on that. I was dependent on mainly regular notes, which I made in foundation and pre-foundation courses. In that, some extra points were there in the T&D notes. I used to just fold pages and then read it once in a while.
Right. Okay. And did you come and revise the after the test as well? What were your lacunas, or what questions did you do wrong, and did you make a list or somehow marked them?
Actually, I didn't do this, but I expect my juniors to do this, because it will be very helpful in the end. I really face problem due to this.
Okay. And did you follow the test schedule, and so you would have finished your course by some time? Then what was your plan after that, when the schedule is over and you now have given all the tests once and revised your subjects once? What was your strategy then?
Like after I completed my course in 7 months around, then the test also continued by almost 7-8 months. Then afterwards I completely shifted on notes part. I kept on revising notes, and once I felt that first one solid reading is important in the initial months. Like 6 months will be enough for that. I made a delay because of the internship and all. 6 months are enough, and then you can easily turn on notes and keep on revising them. That will suffice.
Right. And since you have done both the things, the notes and the testing part, I would want you to know, a lot of students, they would ask you as well, they would ask you that, should they be doing more of questions and extracting the theory from it and then going retrograde, or learning the theory from the questions? What would your suggestion be?
I noticed that if you are going empty-minded and doing questions, starting with questions, then it will take a lot of time.
Right.
First, go for the theory part. Just quick initial solid reading. It must be not leisurely, but keeping pace. Keeping pace.
Right.
And then go for the questions, and you will get to know which concepts you understood and which not. Then you can mark them and revise. Keep on revising them again and again.
Right. And now that you've given all the central institutes, just let me remind our listeners that Gowtham has secured a rank 22 in NEET, but he has also secured a PGI rank 10, which is awesome. And he's also secured a USMLE rank 27, which is again awesome. Right. So he's been very, very, very consistent performer. And since you've given all types of exams, and I really want you to tell your juniors that, do you think that there was a lot of difference in these exams, or the preparation is different? Because they would really want to know this. Because some people would simply say, no, I don't think I'm preparing for PGI, or I'm not preparing for USMLE, and so on and so forth.
Yes, ma'am. This point is, I have heard this from many people also.
Yes.
Because foundation is same for everything.
Right.
But the way to approach the exam differs in every exam. Like in USMLE, out of 250 questions, I was confident on 100 questions only.
Yeah.
Rest 50, and the toppers marks is only 170,
Right.
170 odd, and I got only 160 around, 150 around.
Right.
So don't fear of the unusual things they keep on asking. Just focus on what they what you know, and what everyone will keep tick it right.
Right.
That's important for JIPMER. And for PGI exam, I'd advise to give some test papers, or 2 to 3 test papers. Then you will get to know the time management and the
Yes.
pattern of marking they actually expect students to do in the exam.
Right, but I think you've already said it, that the basic content doesn't really change, and you can see if your content is right, if your study material is right, you will do well in almost all exams. Yes, the strategy could be a little different from paper to paper because the time is different. PGI doesn't have visuals, AIMS and NEET have visuals as well. So little strategy during the exam is different, but the theory content remains the same. Right, and I would want to ask that close to the exams, how important is to give the grand test or mock test like CBT, which is a 300 paper question paper with mixed sort of questions.
Ma'am, it's really important because I gave CBT 1 and I got a rank of 950.
Okay.
I actually
so you bugged up.
Yes,
you ran from there.
Yes, ma'am.
Okay.
I got to know where I was lacking because there are many topics which I could not cover when the CBT exam was conducted.
Okay.
So I again went back to notes and tried to cover all them up.
Right.
And there was depression also due to that rank because but I did not stop there because there was always scope for improvement.
Right. And I think it was a good eye opener at the right time because you did have a good 1.5 month gap between this and the real exams.
Yes,
right. And close to the exam, Bache, what was the strategy?
Close to for every exam, like AIMS was first exam, and I used to do AIMS question papers. Like in eMedico's app, there was a topic called Central Institute Discussion.
That's right.
That was very helpful, and which exam covers which topics. There, it is nicely described in that.
Right.
And in previous year question papers are also available in that.
Yeah, solved with also video solutions.
Yes, ma'am. I use that, and for every exam, prior to 1 week prior to the exam, I just used to do these things, and
right.
I got to know what pattern the exam is going to be.
Okay. Wonderful. And now when we talk about NEET, and if I ask you, what do you think should be the things that somebody who's aspiring to be in your place should do to crack this exam with a good rank as well?
Consistency is the main key to the exam preparation result, ma'am, because there will be ups and lows in the preparation, and there were lows in my preparation too, and Sumer sir was very helpful in this because the sir's motivating videos I used to watch when I was low and keep on, then pushed up myself.
Right.
And also your friends and environment also plays well because there are the people around me are positive people, and they used to push me up, and at their low times I used to push them up, and like it was mutual cooperation.
Yes, absolutely.
And just sticking to book and you are alone in the world, that won't work. Right. Because getting positive attitude, if you fall lack of positive attitude, then you must borrow at times from others.
Yeah, definitely. Why not? And now, how many questions did you attempt in NEET?
Around 290.
Okay. And you must have get quite a few correct as well, because you have a very good rank. And would you want to comment something about Part A, Part B and Part C, the difficulty levels, or maybe what things should people target more on if at all they want to select towards the end or towards close to the exam?
Ma'am, the tiebreaker was the one who scored less negatives in the highest marks in the Part B, Part C.
Part C, and that was the toughest.
Yes,
the most clinical.
Yes, ma'am.
And the one with long questions.
Yes, ma'am.
With conceptuals.
This time, gynae and next surgery was a bit tougher.
Right.
And notes was the key because
it
without
helped you?
Yes, ma'am.
Great.
Yes.
Right. Okay. So, just to conclude once again, if there's a junior and they're asking you, sir, what would be the most important key ingredients that I should put in so that I also get a good rank? What would those be?
I'd like to suggest people only one thing. First, one solid reading, and then notes part. If you haven't had done your notes, it's no big deal. You can join regular course, and there it will be very much sufficient to make your own notes. And
Okay.
so one solid reading, then keep on revising that notes and again, and consistency is the ultimate key.
Wonderful. And anything motivating that you would want to say, or maybe you want to thank someone?
Yes, ma'am. There are many people indeed. My parents, DAMS faculty, my UG college, IMS, BHU, and many of my friends.
Right. So I think the list is very
So,
long.
yes,
Yes, and I would like to wish you all the very best for
you,
a
ma'am.
very bright future ahead, Gautam. And may
you,
you be a great doctor and you get whatever you desire. Best wishes from the entire DAMS team, and God bless you.
Thank you, ma'am.
Thank you.